Welcome to MenInPause, the podcast that changes the conversation about menopause by bringing men into the discussion. I'm David Franklin, one of your co-hosts. My co-host Mimi Fernandez is away today. We created MenInPause because menopause affects relationships, not just individuals. Our tagline is where men listen and women lead. And we have a remarkable woman on our stage today that you will want to listen to. When the women in our lives, or when the women in our lives go through menopause, we go through it too. We just don't always know what is happening or how to help. For this episode, I'm sitting down with the OB-GYN applicant, Estefania Alexandre, to discuss beyond the basics what every man should know about menopause, ovarian health, and intimacy. A conversation to help men understand the physiological changes women experience during menopause, with a focus on ovarian health and the role it plays in intimacy, mood, and overall well-being. Welcome, Estefania. Would you like to give a brief introduction to yourself as well?
Hi, David. Yes, thank you for having me. I'm very excited to be here. I am Estefania Alexandre. I am a medical doctor applying to OB-GYN residency, and my background is in global health. My work focuses on women's health and innovation. And something about me is that I've always been passionate about women's health and making care more modern, accessible to patients, and obviously shining a light on the parts of women's health that don't get talked about enough. So menopause is definitely one of those topics. So I'm really glad we're having this conversation. I feel like it's still surrounded by silence, a lot of misunderstanding, and the more we talk about it openly, the better it gets for everyone. So I'm very happy to contribute today.
Thank you. And we've met relative to menopause, but more from a technical standpoint. So towards the end of the show, I would like you to share more about what's up next for you and what's exciting
Yes.
for you. So let's begin. Understanding the female body during menopause. What are some of the most important physical changes that takes place in a woman's body during menopause that the male partners should know about?
Yeah, so first, I think a lot of people picture menopause like this single event, right? Like one day your body just flips a switch. But in reality, it's an entire process that does unfold gradually and usually over several years. And we call it the menopausal transition. So it can start in a woman's 40s, sometimes even late 30s. And what's underneath the surface is that the ovaries tend to wind down. They're not releasing eggs as regularly. They're producing less estrogen, less progesterone. And these hormones don't just handle reproduction, but they're like the body's what we call master regulators. So they touch everything, your skin, your bones, your heart, your metabolism, your brain chemistry. And that's why women notice these changes way beyond their periods, right? So, what else gets disrupted? Their sleep, their moods can fluctuate, they're feeling more stressed than usual, and then temperature control. So, hello, hot flashes. So, the body's basically learning how to operate on a new hormonal setting. And this is where a lot of male partners tend to get caught off guard because these changes are invisible, I would say. So when a woman is saying things like, I don't feel like myself, it's not her being dramatic, but it's her physiology that's literally shifting. So everything contributes to that, her brain chemistry, her energy levels, her emotional balance, and all of it is being recalibrated. So it's not about, oh, like she's moody, right? It's that her body's working over time and trying to find this new equilibrium. Once your male partner understands that, I feel like it's a lot easier to be understanding instead of getting frustrated and uneasy.
I think this is where knowledge is empowering and being able to share and express and have a better understanding. This is, of course, as a male, we don't have this, but we are impacted indirectly through it. So, in and having a better understanding of the ovaries, or what is the lifespan? I've read articles where people are studying how to extend the lifespan of relative to ovarian health. Is that a positive thing? Will that prolong menopause? Is that there to promote more opportunities for fertility, or should we allow it to just take its natural process?
Yeah, the transition usually lasts. It can be several years. Obviously, it varies by person. And what women can do to prepare or ease that transition is exercise, nutrition, stress management. I know that's a hard one. Sleep as well. It's not the same for every woman. It's unique. Genetics definitely play a role. Lifestyle plays a role. So yeah, I would just focus on nutrition, sleep, and stress management as well as exercise.
Okay, so let's get more into the impact of, say, ovarian health relative to hormones, misunderstanding, and intimacy. So many men are unaware of how hormonal changes impact libido, vaginal health,
Mhm.
and arousal. How can partners better understand these shifts and support their significant other in this transition? And what advice do you give couples struggling with intimacy because of this during this menopause transition?
Yeah, this is a big one. Honestly, I feel like it's where a lot of couples start to misread each other. So when intimacy changes, a lot of men think, oh, my partner's not interested in me. But honestly, it's rarely about interest and it's more about comfort. So as estrogen drops, vaginal tissue loses that elasticity and that natural lubrication. So intimacy might feel dry, tight, painful. And when something hurts, your body's natural response is being like, yeah, no thanks. It's a perfectly normal protective response that we experience. So it's not that a woman doesn't want to closeness, but it's that her body's changing how this closeness feels. But the good news is that this is fixable. There's so many great options out there. There are moisturizers, lubricants, even low dose local estrogen creams that honestly make a very big difference. But I feel that the emotional side matters just as much, right? So if she feels pressure, if she feels guilt, her body will tense up even more. So it's important that men lead with curiosity and don't feel frustrated during this process. So you can ask your partner, like, hey, what feels good right now? Or how can I make this process more comfortable? And I believe that these tiny, respectful check ins do go a long way. And it's also a good time to redefine intimacy a bit. I feel like it's a whole misconception and it doesn't have to start with sex, right? It can be laughter, joking around, touch, affection, or honestly just being present. So I feel like once that emotional safety comes back, the physical side will flow a little bit more naturally. And I advice I would give is for men, just listen. Just listen. And the first thing I usually tell couples is take the pressure off. It's not about performance. Like I said, it's about connection. And menopause truly does change how the body feels and how we relate emotionally. So instead of thinking like, okay, let's get back to normal, it's saying, hey, let's sit down, let's figure out what feels good now. And yeah, so I feel like when a woman does feel relaxed and not judged, her body will naturally follow.
Yeah, there's a lot within what you said. And I had mentioned this on our last episode, a book by Don Luis Miguel, The Four Agreements. Don't take anything personal. And how we're responding, I think when we say intimacy, we may go directly there, but it's much broader than that.
Exactly.
And it's how we communicate before, during, after, but having a more intimate conversation on this topic. That's one area that we need to look at as well. And just being open and understanding that it's a transition and a change, uh,
Right.
not necessarily this is how it's going to stay. But I think it's important that we as men begin to understand this is a remarkable transformation. It's something we need to embrace and to support. Breaking down communication gaps, what are some of the common questions or misconceptions male partners could bring into a clinic or may fail to ask altogether,
Mm-hmm.
right?
Yes. So I've spent years talking with women, their partners, and clinicians, my preceptors and attendings about this. And I feel like the biggest misconception is that menopause is just a short phase, right? Okay, she'll get through it in a few months. But in reality, it can last years. Symptoms, your hormones are changing, symptoms come and go in waves. And I feel that what makes it tough is that most of these hard symptoms that women experience aren't visible. It's not just these hot flashes, it's brain fog, it's fatigue, it's restless sleep. And sometimes it's this subtle loss of confidence when your body feels unfamiliar with what is happening. So these changes can affect everything, work, your relationships, your moods, and they're easy to miss if you're only looking for these stuff that you can see. So I feel that most partners just don't realize how big this impact is because no one really talks about it. And that silence just creates this misunderstanding like, okay, my partner is just stressed, she's not interested, but really she's just managing a full like entire hormonal reset. So I feel that when couples do start naming it for what it is, empathy will replace this confusion. I feel like everything will get a little bit less personal and more human.
So I'm reminded of a book. I think it was a movie too, and I smile when I think about it, but it was What to Expect When Expecting.
Mhm.
But we need version two for menopause. Because
Yeah.
in other conversations and in the last episode, they talked about the pre-menopause or pre-menstruation, all the support that's given to young ladies as they're going into menstruation, but we don't have that same level of hand-holding relationship from somebody else, even from a family standpoint, because here we're not only talking about the lack of conversation with, say, a spouse, but it's within the family structure itself, maybe more of a taboo nature of not to talk about menopause. But I think whether it's menstruation or pregnancy, we've advanced our communications a lot in these areas. And the same thing has to take place around menopause as well. It's well beyond how it was initially classified, even from a clinical standpoint. And
Yeah.
we need to adjust what we know. So now if we look at it from clinic to relationship support, if you will, what do some women delay in bringing up, or why do some women delay bringing up menopause related concerns with their partner or even with their physicians? Why would they be apprehensive to talk about a symptom when they may or may not even know it's menopause related? Or are they afraid of the M word here?
Yeah. A lot of this, I believe, comes down to stigma and not just cultural, but personal too, right? So we, like you said, we live in a world that still ties youth to value, especially for women. So when menopause starts, it can feel like something you're supposed to keep quiet, like a private loss you just deal with on your own. And a lot of women have told me they don't want to seem old or they don't want to be emotional or they think these symptoms are just something you push through. A lot of the times you hear women saying, "Oh, my mom didn't complain. I shouldn't either." And that belief runs deep. And then there's obviously the relationship piece. Many women worry about stressing their partner or changing the vibe at home. They think my partner's has a lot going on. I'll just handle it on my own. But the problem is that silence often turns into distance. And I
Mhm.
feel that the moment you actually bring it up, whether it's to your partner or your doctor, it's like this weight lifts, right? So you realize you're not alone. You don't have to figure these things out by your own. And there's support, right? There's treatment. There's a lot of communities now of women that are going through the same thing. I say speaking up isn't a sign of weakness, but it's like the first step toward taking back the ownership of your own health, reconnecting with your own body again.
Yeah, so I recently was in London and I went to the Pause Live event, and it was really phenomenal to see one, not only products, but communities and community groups where they have memberships of 20,000 plus women, all being supportive in not just menopause, but midlife transition.
Hmm.
And I think to our advantage, I see a lot coming out of Canada as well. And then you have movements within the US and organizations, but this is how to use the internet for good to be able to reach out and to gain back this information. What you had mentioned two things, and we spoke about fertility, ovarian, and you'd mentioned grief just a second ago. And I want to go off script a little bit and ask this question. I think it's a tough question, but is there a level of grief that could be associated with menopause due to the lack of or fertility and not childbearing, that portion going away? That seems very heavy, that there's so much pressure
It
on
is,
a woman
yeah.
that maybe hasn't had a child yet, or maybe they think
Hmm.
just my purpose is gone now. Like, how
Yeah.
can this flow? Because that seems immensely heavy.
Yeah, I feel like it's that fear too, and that embarrassment, or maybe a mix of both. Plus, also, like I stated, this cultural silence that's around aging. I feel like with the stigma, I feel like, yes, it's slowly changing. More women are speaking up, but I feel like we overall need to create a space where it's safe to bring these things up, and it's part of life, right? We can, as partners too, like you can validate, you can have this patience with your partner and curiosity, and nobody should judge. I think it's tough. I know obviously I haven't been through menopause, but I saw it with my own mother, and it's I think more women need to be more open in talking about it because it's part of life and aging, and I don't think there should be any shame around it at all.
Well, it's one of those things, and I would strongly push that menopause should be seen as a chronic care category because you have 7 to 10 years of symptoms leading up to
Hmm.
menopause, meaning clinically menopause is 12 months without a menstruation plus 1 day.
Right.
In the rest of your life, you're postmenopausal, and those symptoms could last 10 years. So you got a 17 to 20-year management window here that we as an industry and society in one way or another has been deficient in supporting, in advancing. Before we close out, what would you say to men, and thank you for being here today, who want to be supportive, whether in the workplace, in their community at large, or in their relationships, want to be supportive but are unsure how to approach the topic or conversation?
Yeah. So I would say start small and lead with empathy. You don't need the perfect words or a script. Sometimes it's very simple, and ask questions like, "Hi, I've noticed you've been tired lately. How are you feeling? How can I help? Is there anything I can do to make things easier for you?" I feel like that kind of gentle curiosity opens the door without pressure or judgment. And you don't have to be an expert to care. Just being able to listen and learn says a lot. Men, please do your homework, read a few articles, listen to podcasts, ask questions. David, you have an incredible platform. I feel that once you understand what's happening, it's much easier to respond with compassion to your partner, and patience too. Please practice patience. Patience really goes a long way here. These hormonal changes can make women feel unpredictable, right? So when a partner doesn't take it personally and says, we'll figure this out together, that's huge. Menopause does not have to create any sort of distance. If anything, it can open up honest conversations about a woman's health, about intimacy, about growing with your partner. And I feel like couples who do handle this as a team usually find that the communication between each other does get easier, and then everything else just flows ahead too.
Yeah, I think in something you said there that I want to point out, you said I see. So saying words and learning to communicate from their perspective. I see this, I hear this, I feel
Mm-hmm.
this, versus you seem to be,
You.
yeah, like it's not a you statement. We have to take it back to ourselves. And that's just a communications. We just need to learn to be better communicators, observers, be curious there. As we close, what's exciting in your world of ovarian health? And give me a few minutes about what's going on. What's your passion at right now?
Yes, so I have a lot going on right now. I decided to create my startup this year. It is called Ovawise, and it's an at-home women's health platform I founded that helps track and understand a woman's hormonal health and ovarian health in a more proactive way. So it has three components to it. It is a small pelvic belt, a simple finger prick biomarker test, and then an AI app that looks at these consistent patterns over time. So things like inflammation, hormone changes, early risk signals as well. So the goal is to give women better information about their bodies before problems do become serious, like how like aura ring works, heart rate monitors, changing how we think about fitness. So my three pillars of focus are PCOS, endometriosis, and ovarian dysfunction, so potentially ovarian cancer and fibroids as well. So that's currently what we are working on at Ovawise.
Thank you so much for being our guest. Thank you for the technology and the care that you're bringing to market as well. And we look forward to continuing the relationships. So today, thanks for listening. If you're a man who wants to better understand and support the women in your life, or if you're a woman who wishes the men around you just get it, please subscribe for more episodes, because when it comes to menopause, nobody should be going through it alone. We'll see you next time on Men in Pause podcast. Thank you.
Thank you.